What if we told you there's a virus out there that's causing global panic? One that's spreading faster than wildfire across continents? Imagine a disease that can make your skin erupt in painful blisters, send your fever skyrocketing, and leave you feeling like you've been hit by a truck. Sounds like something out of a sci-fi movie, right? Well, buckle up, because this is no fiction. This is MPOX. Now, you've probably heard whispers about MPOX spreading across continents, causing panic, and potentially becoming the next global health crisis. But here's the thing. While the situation is indeed serious, there's a lot of misinformation floating around out there. So let's cut through the noise and get to the heart of the matter. We're going to explore what MPOX really is, why it's causing such alarm, and what it means for you and your loved ones. A new threat emerges. Close your eyes for a moment and imagine it's 2022 and the world is still reeling from the effects of the COVID-19 pandemic. Just when we thought things couldn't get any crazier, boom! A new virus steps into the spotlight. Enter MPOX, formerly known as monkeypox. Now you might be wondering, why the name change? Well, let's just say the World Health Organization wanted to avoid any stigma associated with the original name. The plot thickens. Latest news. Fast forward to 2024 and things are getting intense. The academic journal Science has sounded the alarm about MPOX, spreading like wildfire across African countries. It all started in the Democratic Republic of the Congo, DRC. But now Uganda and Kenya have joined the party, and not in a good way. The fear is that this nasty virus could soon crash through the entire continent. But wait, there's more. The World Health Organization, known as WHO for short, is so concerned that they're considering declaring an international health emergency. That's like the bat signal for the medical world, folks. The head honcho at WHO, Tedros Adhanom Ghebreyesus, is even thinking about forming a special committee to decide if it's time to hit the global panic button. Origins. Where did this virus come from? Now, let's rewind a bit. MPOX isn't exactly the new kid on the block. Scientists first discovered it back in 1958 in a group of research monkeys in Denmark. But it wasn't until 1970 that the first human case popped up. A 9-month-old boy in the Democratic Republic of the Congo. Talk about being in the wrong place at the wrong time. Since then, MPOX has been hanging out in Central and Western Africa, occasionally making guest appearances in other parts of the world. But in May 2022, something changed. The virus decided to go on a world tour, spreading rapidly across Europe, the Americas, and eventually all 6 WHO regions. It was like watching a viral version of Around the World in 80 Days. The virus's favorite hangouts. Now you might be wondering where MPOX likes to party. Well, it's not picky. As of August 2024, over 120 countries have reported cases, with more than 100,000 confirmed infections. The virus seems to have a soft spot for the Democratic Republic of the Congo, where a new strain called Clade Ib has been making waves. And by waves, we mean causing a surge in cases and deaths. Not cool, MPOX. Not cool at all. Symptoms. What to watch out for. So, what happens when MPOX decides to crash your body's party? Well, it's not pretty. The most common uninvited guests are a nasty rash that can spread all over your body, and we mean all over. Fever that'll make you feel like you're in a sauna. Headaches that'll have you reaching for the aspirin. Muscle aches that'll make you feel like you've run a marathon without the medal. Swollen lymph nodes that'll have you looking like a chipmunk. And to top it all off, extreme fatigue that'll make your bed feel like a magnet. But here's the thing. These symptoms can take anywhere from 1 to 21 days to show up after exposure. Talk about playing the waiting game. Transmission, how this virus gets around. Now let's talk about how MPOX likes to travel. This virus is all about that close contact life. It spreads mainly through skin-to-skin contact, but it's not opposed to a little mouth-to-mouth action either. And sorry to break it to you, but that includes kissing and sex. So, if you're thinking of getting frisky with someone new, you might want to think twice during an outbreak. But it's not just about human-to-human transmission. MPOX can also spread from animals to humans. So if you're planning a wilderness adventure, maybe hold off on cuddling with that cute squirrel or monkey you come across. At-risk groups. Who's in the hot seat? While MPOX doesn't discriminate and can infect anyone, certain groups of people are at a higher risk of catching the virus or experiencing more severe symptoms. It's important to understand who these vulnerable populations are, not to stigmatize them, but to ensure they receive proper care and protection. Let's take a closer look at who might be more susceptible to MPOX. First on our list are healthcare workers. These brave individuals are on the front lines, coming into direct contact with infected patients. Despite protective equipment, their frequent exposure puts them at increased risk. Next, we have people living in the same household as someone with MPOX. Close, prolonged contact in shared living spaces makes it easier for the virus to spread from person to person. Another group at higher risk includes individuals with multiple sexual partners, particularly men who have sex with men. This isn't because of their sexual orientation, but rather due to the close skin-to-skin contact that occurs during intimate activities. Sex workers and their clients also face increased risk for similar reasons. Frequent close contact with multiple partners can provide more opportunities for the virus to spread. People with weakened immune systems, including those living with HIV, are another vulnerable group. Their bodies may have a harder time fighting off the virus if they become infected, potentially leading to more severe symptoms or complications. Lastly, pregnant women and their unborn babies are considered high risk. The virus can pass from mother to child during pregnancy or shortly after birth, potentially causing serious health issues for both. The global response. Fighting back. So, what's the world doing about this viral menace? Well, it's like watching a global game of whack-a-mole. The World Health Organization is working overtime, collaborating with the Africa Centers for Disease Control and Prevention to scale up prevention efforts. But as always, money talks, or in this case, the lack of it. Funding shortages are making it tough to implement all the necessary measures, but there's a glimmer of hope. The African Union has released $10.4 million from existing COVID funds to help fight MPOX. It's like robbing Peter to pay Paul, but hey, whatever works, right? Prevention and treatment, keeping MPOX at bay. Now, you're probably wondering, how can I avoid becoming MPOX's next victim? Well, we've got some tips for you. First and foremost, if you can get vaccinated, do it. It's like giving your immune system a crash course in MPOX defense. If you've been in contact with someone who has MPOX, isolate yourself faster than you can say quarantine. Practice good hygiene. Wash those hands like you're auditioning for a soap commercial. If you're in a high-risk group, consider taking a break from sexual activity with new partners during outbreaks. Your libido might not thank you, but your health will. As for treatment, it's mostly about managing symptoms and preventing complications. There are some antivirals being tested, but for now, it's all about supportive care. Think of it as giving your body a pep talk while it fights off the virus. The future. What lies ahead? So where do we go from here? Well, the MPOX story is still unfolding. Scientists are working around the clock to understand this virus better and develop more effective treatments and vaccines. But one thing's for sure, this outbreak has taught us the importance of being prepared for emerging infectious diseases. As we've seen with COVID-19 and now MPOX, viruses don't care about borders or social status. They're equal opportunity invaders. That's why global cooperation and investment in public health are more crucial than ever. And there you have it, the saga of the MPOX virus. From its humble beginnings in Danish research monkeys to its current status as a global health concern, this virus has certainly made a name for itself. But remember, knowledge is power. By staying informed and taking precautions, we can all play a part in stopping MPOX in its tracks. So, the next time you hear about a new virus outbreak, don't panic. Instead, arm yourself with information, follow expert advice, and maybe stock up on hand sanitizer. After all, in the words of the great Louis Pasteur, chance favors the prepared mind. If you found this video helpful, don't forget to like and subscribe for more content that cuts through the hype and brings you the real science in health. Until next time, stay curious and take care.